Hi friends, welcome to the channel The Nurse. Here we are discussing about latest nursing questions and answers that will be helpful for preparing ESIC nursing officer exams and upcoming nursing tutor exams. ESIC recruitment we are expecting soon, so you can start preparing now itself. So best wishes. We will go to our topic. Before that, if you are not subscribed to our channel, please subscribe. We will go to our topic. ESIC and nursing tutor exams questions and answers with rationales. First question. Mild depression that lasts for at least 2 years is termed as dysthymia, cyclothymia, euthymia, parathymia. Correct answer is dysthymia. Mild depression that lasts for at least 2 years is termed as dysthymia. It is a chronic type depression, that is mild type only. Cyclothymia means it is a mild type of BPD. There will be depression and mania in cyclothymia, mild form of depression and mania that is seen in cyclothymia. Euthymia is a normal mental status, that is called euthymia. Parathymia means that is particular symptoms that will be seen in schizophrenia. That is mainly the persons will exhibits the opposite feeling. So that kind of symptoms is known as parathymia, that is usually seen in schizophrenia. Dysthymia, it is a mild chronic form of depression, while cyclothymia is a mild bipolar disorder that involves cyclic between mild depression and mild mania. Dysthymia means it is a chronic form of depression, mild depression that may be last for 2 years. And cyclothymia, same time, it is a mild form of mania and depression. Euthymia means it is a normal mental state or mood, that is known as euthymia. Parathymia means it is a expression of opposite feeling, opposite emotional feeling. If a patient is having one happy situation, he will behave like a sad. So that is parathymia, that is usually seen in schizophrenia. Second question. World Mental Health Day theme for the year 2022 is. World Mental Health Day theme for the year 2022 is Young People and Mental Health in a Changing World, Making Mental Health and Well-Being for All a Global Priority, Mental Health in a Workplace, Mental Health Promotion and Suicide Prevention. Correct answer, Making Mental Health and Well-Being for All a Global Priority. So World Mental Health Day is October 10th, the 2022. World Mental Health Day theme is Making Mental Health and Well-Being for All a Global Priority. World Mental Health Day will be celebrated on the 10th of October 2022, that is next month, with the theme Make Mental Health and Well-Being for All a Global Priority. So this is the Mental Health Day logo that is celebrated on 10th of October every year. Third question. The drug of choice for Attention Deficit Hyperactivity Disorder, that is ADHD. The drug of choice for Attention Deficit Hyperactivity Disorder. Risperidone, Ritalin, Donepezil, Oxetol. Correct answer is Ritalin. It is a trade company name or trade name. The pharmacological name is Methylphenidate. Ritalin is a company name and the pharmacological name of the drug is Methylphenidate, that is used for the treatment of Attention Deficit Hyperactivity Disorder or ADHD. Methylphenidate sold under the brand name Ritalin, and it is also sold under Concerta. That is both the company name only, among others. It is a central nervous system stimulant medication used to treat Attention Deficit Hyperactivity Disorder and to a lesser amount narcolepsy. So methylphenidate is used to treat for the Attention Deficit Hyperactivity Disorder and also in some cases narcolepsy. For the treatment of narcolepsy also we can use. Narcolepsy means excessive sleep in the daytime. So in both cases, we can use methylphenidate or the company name Ritalin or Concerta. So this is the use of methylphenidate. And methylphenidate, it is believed to work by blocking the reuptake of dopamine and norepinephrine by neurons, because mainly the dopamine helping for attention. So the methylphenidate will prevent the reuptake, that is absorption of available dopamine into the neurons. So by preventing that means there will be more dopamine available at the synapse or neuronal junction. So that will improve the patient condition. That is mainly provide the attention span. So that is a pharmacology of methylphenidate action. So next question. The first Director General of ESIC was? The first Director General of ESIC was Professor Adarkar, Dr. C.L. Katyal, Pandit Jawaharlal Nehru, Brijendra Swarup. Correct answer, Dr. C.L. Katyal. The first Director General of ESIC, that is Dr. C.L. Katyal. The ESIC Act, that also started the ESIC Act that is came in force, that is on 1948. So during that time, Dr. C.L. Katyal was the first Director General of ESIC. Fifth question. The form of behavior therapy in which the patient is directly exposed to phobic stimuli and escape is made impossible. Aversion therapy, systematic desensitization, token economy, flooding. Correct answer is flooding. Flooding means the patient is directly exposed to the fearing situation, and the person will help the patient to cope up with the situation. Systematic desensitization also we can use in a phobic condition, but in that systematic desensitization means it is a gradual exposure to the phobic stimuli. But flooding means at a time the patient will be exposed to the same phobic stimuli, but systematic desensitization means it is a step-wise exposure. So person will expose a smaller amount at initial time, then gradually it will increase. So the person is able to cope up with the situation in this systematic desensitization. Flooding means at a time the person is exposed to the phobic situation, and the healthcare worker will help the patient to cope up with the situation. Aversion therapy means it is used to avoid the bad behavior and all. That is mainly focused in aversion therapy. Token economy means it is like operant conditioning. It will give rewards and punishment according to the patient behavior. So to modify the patient behavior, it will give rewards. If any bad behavior is happening means there will be a punishment method also. So that is token economy. It is was as the principle of operant conditioning. Next question. Projective technique used for the assessment of personality. WAIS, that is voice, TAT, MMPI, MMSE. Projective technique used for the assessment of personality. Only one technique in the option that is used for the that is the example of projective technique used for the assessment of personality. You need to find out. So correct answer here, that is TAT. So I will tell you the explanation. Before that, WAIS, that is Wechsler Adult Intelligence Scale. WAIS, Wechsler's Assessment Adult Intelligence Scale, that is used to assess the child's intellectual abilities and particularly cognitive strength and weakness. WAIS, that is used for the assess the child intellectual ability and cognitive strength and weakness. MMPI, that is Minnesota Multiphasic Personality Inventory, that is used to assess and diagnose mental illness. MMPI, that is Minnesota Multifaceted Personality Inventory, used to assess and diagnose mental illness. MMSE means that is mini mental status examination, that is used to assess the patient mental status during the admission time in a quick ways. So in that the healthcare worker or psychologist or psychiatrist can diagnose the patient condition. Projective tests are intended to uncover the feelings, desires, and conflicts that are hidden from unconscious awareness. Projective test means they are intended to uncover feelings, desires, and conflicts that are hidden from conscious awareness. So we will see how it will work by interpreting responses to ambiguous cues. Ambiguous means there will be two options. Two opposite option is there, then the patient has to tell what is coming in his mind. By interpreting responses to ambiguous cues, psychoanalyst hopes to uncover unconscious feelings that might be causing problems in a person's life. So there will be certain types of projective tests. I will tell you the names of the common projective tests used to assess the personality. So they are, first is the Rorschach Inkblot test. In Rorschach Inkblot test, that there is a series of pictures, and it will show to the persons one by one, and he has to interpret the meaning of pictures. So that is a mainly used the theory that is used in Rorschach Inkblot test. Then second, that is our question, that is TAT, the thematic apperception test. In thematic apperception test, there will be one picture or one theme. The person has to interpret what is the meaning of theme, what are the he has to make a story with that theme. So that is used in thematic apperception test. And third one is the draw a person test, and fourth one is house tree person test. In that and all, the person need to draw a picture, and based on that they will the psychoanalyst will interpret what is going on in his mind. So that is the projective test used in the assess the personality. So next question, the type of learning in which a neutral stimulus brings about a response after it is paired with natural stimulus. The type of learning in which a neutral stimulus brings about a response after it is paired with natural stimulus. Classical conditioning, operant conditioning, trial and error learning, insightful learning. Correct answer is classical conditioning. Classical conditioning means the type of learning in which neutral stimulus brings about a response after it is paired with a natural stimulus. So it is an example of classical conditioning. So I will explain with the picture. So classical conditioning definition, this learning process creates a conditioned response through association between an unconditioned stimulus and a natural stimulus. So before conditioning, the food is introducing to the dog. So food is known as unconditioned stimulus. So natural response, unconditioned response, that is salivation. So in the same time, then a natural stimulus the analyst brings, that is whistle, the sound of whistles. So that is first initial, before conditioning, there is no response from the dog. But again, the food is introducing with the sound of whistle. So that time, unconditioned response. Same, the food is bringing in front of the dog along with the sound of whistle. So that time, the same salivation is coming. That is unconditioned response. So then next time, even the dog is hearing the sound of whistle, that time there will be a conditioned response. The salivation automatically will come, because previous time the food has come along with the sound of whistle. So this time also the dog is expecting food along with the sound of whistle. But actually food is not introduced to the dog. Even with the sound of the whistle, the dog is getting salivation. That process is known as classical conditioning. And I told you one more conditioning that is used operant conditioning. In operant conditioning, there will be the behavioral change that is made with reward and punishment that is used in token economy. So to modify the behavior, there will the analyst will introduce a token. If person is acting or maintaining a good behavior that time or getting that target behavior, so that time a token will give to the person as an appreciation or a reward. If person is again showing the repeated bad behavior, then he will remove that token from the person. So that is a punishment. So that kind of behavior modification is known as operant conditioning. Operant conditioning mainly that is with rewards and punishment. Operant condition is method of learning that occurs through rewards and punishment for behavior. So if he is getting a good behavior, then we'll give rewards. If he is showing the previous bad behavior means, then the punishment will be given. Eighth question. Two-factor theory of intelligence was developed by Howard Gardner, Stanford Binet, Robert Sternberg, Charles Spearman. Correct answer is Charles Spearman introduced two-factor theory of intelligence. We will see briefly about the two-factor theory. Spearman concluded that there is a single factor, that is G factor, which represents an individual's general intelligence across multiple abilities. And that a second factor, that S, that refers to an individual's specific ability in one particular area. For an example, the Spearman is explaining that all the people have some G factor, that is a general intelligence with to solve multiple situations. But at the same time, there will be a specific intelligence ability that is known as S factor. S factor, that will be some person will be very good in mathematics, or very good in repairing mechanical, or very good in speech. So these and all, it is a second factor. It is known as S factor according to Spearman. There will be a G factor, that is a general intelligence and specific to the particular ability, that is known as S factor. S factor will be different from each person's. Next question. The ESIC day is celebrated on. The ESIC day is celebrated on October 10th, February 24th, May 12th, September 25th. Correct answer is ESIC day is celebrated on February 24th. 10th question. Part of brain responsible for speech production and articulation. Broca's area, Wernicke's area, prefrontal area, primary motor cortex. So these kind of questions are repeating most of the time. AIMS, NIMANS, every time these kind of the aphasia, Broca's aphasia, Wernicke's aphasia related questions are coming very frequently by slight modifications. So these questions also, it is related to Broca's and Wernicke's area. So question is part of brain responsible for speech production and articulation. So correct answer is Broca's area. Broca's area helps to produce speech production and articulation. Any damage to the Broca's area, it will make problems in speech production and articulation. So that is why Broca's aphasia is known as expressive aphasia, because expression or speech production, it is blocked due to the damage to the brain area. So Wernicke's area, same time, it is known as receptive aphasia. Any damage to the Wernicke's area, it will cause receptive aphasia, because the receiver of that speech and written words, speech, these and all help recognized by Wernicke's area. So any damage to the Wernicke's area will make problems in the reception of the written or spoken words. So that will known as receptive aphasia. Any damage to the Wernicke's area that will leads to receptive aphasia. Broca's area, it helps in speech production and articulation. So any damage to the Broca's area will leads to expressive aphasia. Wernicke's aphasia cause you to speak in a jumbled word salad that others can understand. So same time he is able to make a big sentence, but that will not be give any meaning to others. He tell long sentences, but there will not be a meaning for the sentence. So that is why it is known as receptive aphasia. Patient is having problems in receiving the spoken words or written words. So that is why it is known as receptive aphasia or sensory receiving. Sensory means it is receiving things. So that is why it is known as sensory aphasia. Or why it is known as fluent aphasia means the person is able to make a long sentence, but without fluent sentence he is able to make, but the others cannot understand, but he is still able to make a long sentence. So main area, the Wernicke's area, it is located in temporal lobe. The area affected in Wernicke aphasia is temporal lobe. Broca's aphasia, that is what I told you in previously. So Broca's aphasia leaves you with limited language. Speech production is affected. You might only be able to say single words or very short sentence. That is why it is known as expressive. Expression is mainly affected. So, but even with that single words or short sentence, the other person can be able to understand what the person is telling. That is happening in Broca's aphasia because it is also known as expressive aphasia. Why it is known as expressive aphasia? Because expression, the speech production is damaged. And it is also known as non-fluent aphasia. Non-fluent aphasia means the person is limited to make a long sentence, and he will tell one or very short words only. So that is why it is known as non-fluent aphasia. But others can understand with this short sentence or with one word. In Broca's aphasia, the main area that is damaged, that is frontal lobe. So I think it is clear. Wernicke's aphasia and Broca's aphasia, very repeated question. So understand very well. 11th question. Drug used to improve the cognitive function in patients with Alzheimer's disease. Ritalin, Risperidone, Donepezil, Oxetol. Correct answer is Donepezil. The same medicine is used for the treatment of dementia to prevent the progress of dementia. The same drug only, Donepezil, that is also used in the treatment of or improve the cognitive function of patients with Alzheimer's disease, because it will reduce the progression. So I will explain the pharmacological action of Donepezil. Donepezil prevent an enzyme called acetylcholinesterase from breaking down acetylcholine. Acetylcholinesterase break down acetylcholine. That is a neurotransmitter. So by preventing the breakdown of acetylcholine, there will be more available acetylcholine in the neuronal junction. So it will improve the neuronal conduction. So that is why it is reducing the progression of dementia or improving the cognitive function in Alzheimer's disease. This means there is a higher concentration of acetylcholine in the brain, which leads to better communication between the nerve cells. This may ease some symptoms of Alzheimer's disease for a while. Completely, it will not go, but it will ease some symptoms of Alzheimer's disease. 12th question. Disorder characterized by hyperarousal, flashbacks, emotional numbness following a disaster. Phobia, post-traumatic stress disorder, acute stress reaction, adjustment disorder. Correct answer is post-traumatic stress disorder. Post-traumatic stress disorder is a condition of persistent mental and emotional stress occurring as a result of injury or severe psychological shock, typically involving disturbance of sleep and constant vivid recall of the experience, with a dulled response to others and to the outside world. Symptoms may include nightmares or flashbacks. The person will get repeated flashbacks or a memory of the incident, avoidance of the situation that brings back the trauma, heightened reactivity to stimuli, even for a small issue, that person will make a very big reaction towards that stimuli. That is known as heightened reactivity to stimuli, anxiety or depressed mood. These are the symptoms of post-traumatic stress disorder or PTSD. Treatment includes a different type of psychotherapy as well as medication to manage symptoms. Next question. Which among the following is the Snyder's first rank symptoms of schizophrenia? Delusion, somatic passivity, ambivalence, asociality. Like Bleuler's 4A, Snyder's also made some group of symptoms that is categorized first rank symptoms, second rank symptoms, third rank symptoms. So out of that, these options, which one is included Snyder's first rank symptom of schizophrenia? Correct answer is somatic passivity. Somatic passivity includes Snyder's first rank symptom of schizophrenia. We will go to the details. Snyder's first rank symptoms or FRS, which includes auditory hallucination, that will be any commanding, commentary. These are the main auditory hallucination. Thought withdrawal. Suddenly while talking, he will stop talking. So that is called a thought withdrawal. And thought insertion. Some while talking a particular topic, some other topic will come inside, and the patient will talk about that different topic. That is thought insertion. And interruptions. Thought broadcasting. So person will think like that his thoughts are getting broadcasted into others. So what he is thinking inside his mind will broadcast into others, and they are knowing what he is planning to, what he is thinking. And somatic hallucinations, delusion, perception, feelings or actions as made or influenced by external agents. These are included in Snyder's first rank symptoms. So according to Snyder's first rank symptoms, we can diagnose the patient if there is a schizophrenia. So DSM-5 categorization, the telling mainly two symptoms of Snyder's first rank symptoms should be there to diagnose the schizophrenia. Earlier in DSM-1 classification, according to DSM-1 classification, they told that even one symptoms from Snyder's first rank symptom is enough to diagnose the schizophrenia. But now it is widely using DSM-5. DSM-5, at least two symptoms of Snyder's first rank symptoms should be there to diagnose the schizophrenia. 14th question. Amount of electric current applied during ECT. 60 to 70 volts, 50 to 80 volts, 70 to 120 volts, 140 to 160 volts. Correct answer is 70 to 120 volts used for the electroconvulsive therapy. Electroconvulsive therapy is a procedure done under general anesthesia in which small electric current are passed through the brain, intentionally triggering a brief seizure. So a small current will pass through the brain and will induce a brief seizure. And ECT seems to cause changes in brain chemistry that can quickly reverse symptoms of central mental health conditions. Mainly ECT indicated for the severe depression and severe suicidal thought patients. Nowadays, in some other cases also it is using, that is drug-resistant mania or drug-resistant dementia, delirium. So in this condition also it is used, but mainly it is used for severe depression and suicidal thoughts. 15th question. The Employee State Insurance Corporation or ESIC comes under Ministry of Health and Family Welfare, Ministry of Home Affairs, Ministry of Labour and Employment, Ministry of Human Resources Development. Correct answer, Ministry of Labour and Employment. ESIC comes under Ministry of Labour and Employment. And in our AIMS, NIMANS, JIPMER, PGMRR comes under Ministry of Health and Family Welfare, but ESIC comes under Ministry of Labour and Employment. 16th question. The concept of therapeutic community was developed by Benjamin Rush, Sullivan, Maxwell Jones, Philip Pinel. Correct answer is option C, Maxwell Jones. Next question. Which among the following is a therapeutic impasse? Transference, theme identification, humor, silence. Therapeutic impasse means anything that blocks the therapeutic relationship. That is known as therapeutic impasse. Here, one example for therapeutic impasse is transference. Transference means the patient is thinking the healthcare worker is relation or is related to the patient. So that is known as transference. So there are examples for therapeutic impasse. Therapeutic impasses are blocks in the progress of the nurse-patient relationship. Examples of therapeutic impasse means impasse are resistance. That means patient is not opening his mind. Or transference. Transference means I told you that is patient is thinking the healthcare worker or nurse is related to that patient, or like that his patient is thinking. Counter transference means the nurse thinking that the patient is brother or sister or father, mother, uncle, like that. That the nurse is thinking like that means it is known as counter transference. There is boundary violence. Boundary violence means the nurse-patient relationship will go into the social relationship or social media relationship or financial relationship, that and all known as boundary violence. Then gift giving. Gift giving means patient is giving gift to the healthcare worker for the care during the hospitalization, that and all. It will lead to gift giving. It will lead to therapeutic impasse. So next question. The side effects of antipsychotic associated with increased level of creatine phosphokinase. Akathisia, dystonia, tardive dyskinesia, neuroleptic malignant syndrome. Correct answer is option D, neuroleptic malignant syndrome. So mainly CPK is elevated in neuroleptic malignant syndrome. It is fatal side effects of antipsychotic. If it is untreated, patient will die. So that is about today's video. 18 questions we have discussed here. So if you like this video means please press the like button and share with your friends. And if you have any doubt means you can ask in comment section. I will try to solve your doubts. So thank you for watching this video. Bye bye.